Many of the kids which are in BDA program have a problem with the reflux. So I'm going to explain now how BDA look at this kind of problem and how we address it. So kids can have a reflux that have cerebral palsy, that have genetical disorders. Even when they are much older, they can be 5 years old, 10, 15. Many times they can have reflux, which means after some meals they can throw up very easily, and this is causing them a lot of problems. They can even feel even the pain in the stomach area because of that. And so one interesting thing is about that every baby also have a reflux. So every newborn baby until some age, some period, about 3-4 months, have a common problem that when it eats, it can easily throw up. So I'm going to use the example of the baby in order to explain why is this happening with kids that have cerebral palsy as well. So first of all, we need to understand why does it happen normally with the baby and nobody make a big fuss out of it. So a small baby will throw up and everybody is fine with that because it's expected. So a small baby have also, we talk many times about that, in a way a primitive structure. When I say primitive structure, it's basically a structure which is underdeveloped. So it means that many things are not properly segmented. So small baby have something which we call a monotorso. So it means that the chest is not so wide and it didn't gain the depth, the width, doesn't have the volume. Also a small baby doesn't have the waist, so everything look like one. So when you look at a child that is 2 years old, for example, even 1.5, you can start to see the waistline, you can slowly start to see the physiological curves in the spine, you can see a longer neck. All these things the baby don't have. The baby in the beginning have a short neck, have very narrow shoulders, chest and the stomach that look like one, almost like a shape of the egg. So in this period of time also, the baby also have a little bit weak chest. So that's another thing which is very, very normal. Some kids have a little bit stronger chest from the beginning. If the child is a little bit premature, the chest is definitely going to be weaker, but they also have a bit weaker chest, comparison how it become after 6 months and so on. So later in time, we will get all these, let's say, super developed structures, which mean that the child start to get the neck, then the chest become wider, start to get the waist, the pelvis, which by looking at the pelvis you see it's better segmented, it's more separated from the stomach, and so then slowly from more primitive structure we are getting the structure which is more, let's say, advanced structure. So in this, let's say, phase of the primitive structure, what have a really big effect on the reflux is actually the child breathing. And for the breathing, it's very important the diaphragm. The diaphragm is important because it's separating the torso into 2 sectors. So we can call it A and B. So the diaphragm is like a, it's like a wall which is separating the upper and the lower part, and it's moving. So the main role of the diaphragm is actually to manipulate with the pressure inside of our chest, inside of our whole torso actually. So when the diaphragm go down, the pressure is going to be reduced inside of the chest cavity, and then what is going to happen, the air will come in, simply because of the difference in pressure. So when the child bring the diaphragm down, the pressure here will be reduced, and because the pressure around the child is higher, you get the equalization of the pressure, so the air will come in inside of the chest. But that's not where, if the diaphragm move up and down, it's not just going to change the pressure inside of the stomach area, inside of the chest area, it will also influence the stomach area. So when the diaphragm go down, in the upper part the pressure will be reduced, but in the lower part it will be increased. So basically, when the child inhales the air, the diaphragm go down and it's creating the pressure inside of the stomach area. So literally imagine like this diaphragm go down and just push everything down. And we actually use that even for When we go to toilet, when we want to defecate, we use that pressure, so we inhale the air and then we pump with our diaphragm in order to defecate. Now, so this is what the diaphragm is doing, and what is the problem in the beginning? Well, the problem in the beginning is that there is a conflict between what is happening in the upper part of the torso and what is happening in the lower part of the torso. So basically, when we breathe, it's how to say, very good segmented what is happening with the upper part and the lower part during the breathing. The chest reduce, air come in, chest expand. The diaphragm goes up, it's pushing everything away, the stomach gets a little bit, the pressure inside of the stomach is reduced. So what happened in the upper chamber and the lower chamber with the more developed structure is very well defined. But when the structure is not so well developed, there is, let's say, basically there is no good separation between the upper part and the lower part. And this is what can cause the child a problem where basically the problem with this kind of distribution of pressure can actually cause that there is that certain suctioning is happening within the stomach area, and then very easily the food can slowly go up and the child feel the need to throw up. So another reason why this is happening is because when the child is a little bit older, the chest becomes also much more stronger. So then the diaphragm, which is in between, doesn't really have to work so much. So a small movement of the diaphragm will be enough to reduce the pressure inside of the chest. But if the chest is a little bit weaker, then the diaphragm have to work more, have to deliver a little bit more of the effort. So the reason why that happens is because when the diaphragm moves down, the diaphragm is reducing the pressure in the chest area, and if the chest is weak, then the surrounding pressure can cause the chest to collapse. So then what happens? The chamber is losing the integrity. And then when the child inhales the air, the chest collapses a little bit. So basically, kind of the diaphragm is pulling the chest in. And when that happens, the diaphragm cannot create the difference of pressure between the outside, the surrounding environment, and what is happening within the chest. So then the diaphragm has to go even more down, it has to push, let's say, pull even more down, in order to create that space, which will create something which we can call a vacuum effect. Like, it's not really a vacuum, but it's reduction of pressure. So then this excessive work of the diaphragm is actually going to create even more pressure on the stomach, and that can actually cause not so good dynamic in the internal organs, because when we breathe, our organs are moving all the time, and this have a very major effect on the peristaltic. When that is not correct, then there could be a conflict, there could be a problem, the child is breathing a little bit harder, the diaphragm is moving more down than it should, and that can actually cause this kind of problem with the internal pressure, which can cause the food to go out, the child could feel discomfort about that, and then it can easily throw up. In time, the structure is developing. So then what happens? The chest becomes stronger, the stomach it become a little bit, let's say this whole area get longer, the child is gaining the waist area, the spine is getting developing different curves. All that together very positively influence also on development of the pelvis. So in general, the whole torso is improving. And then when that is the case, the movement of the diaphragm is creating, let's say, a very solid effect on the upper part and the lower part. So let's say very clear, and there is not really a conflict between what is happening in the upper chamber and the lower chamber. And thanks to that, we can eat a lot, and maybe we will feel a little bit, not so good after that, but we are not really going to throw up. But when the child eats a lot, which is, for example, a baby, simply because of the breathing, simply because of the a normal life, daily spontaneous activities, it can feel the need to throw up, and that is because all that is actually connected not just with the stomach area, or for example with the guts, or what the child ate. It actually have it's connected with the way how everything works together, how the upper chamber and how the B chamber is functioning. So then, if the child didn't really through time develop all these superstructures, developed structures like chest, stomach, pelvis, very well segmented, then the child is growing, it's getting bigger, but it still has some qualities like a small baby. So for example, the child could be 10 years old and when it's laying on the back, still is holding the hands in this position, as for example a small baby would. That's because that position of the hands is the most comfortable, since that's the position of the clavicles, which are close to the neck, and the shoulder blades, and all that is causing the child to kind of feel this position is the most comfortable position, because the child feel what feel comfortable in respect to the neutral state of the child body. So the child with cerebral palsy have a not so good development of the whole structure, and then it's growing but is not gaining the proper qualities of the structure. So some things which are connected with the baby reflex stay with the child that has cerebral palsy even later in life. And this can fluctuate. There is a moment when the child, for example, had a problem with reflex, then for a couple of years doesn't have a problem with reflex, then again it can happen. And this is very complex because it's connected with the growth spurt. So basically, there is a periods when the child is elongating, then the periods where the child is, let's say, gaining the weight, then it's not gaining the weight anymore, but it's getting to be longer, then it's gaining the weight again. So it's like going in the steps. And according to these phases of the child development, so there is a period when the child have less reflex, there could be a period where the child have more reflex, and it can also be connected with the child is eating, because even if the child have a tendency towards the reflex, towards the reflux, if the child have a proper diet, it can reduce a little bit this kind of need to throw up. But what is the BDA approach to this? So we focus on the general development of the child torso, of the child whole body, and we are improving the super curves of the spine, development of the chest, gaining the waist area, integrity of the stomach, and the volume and other qualities of the pelvis. So all that together is improving the child to reduce this kind of need to throw up and this kind of tendency towards the reflex. So basically, if you want to change the reflex, it takes time for that. It's not some specific areas where we have to work and address them. It is a general thing connected with the whole torso and general development of the child. It's very much connected with the breathing, because kids with cerebral palsy have a weak chest, and when they inhale the air, the chest is not properly expanding, so the child then have to work more with the diaphragm. Then the stomach starts to bulge, and all that can cause the child to have a reflux. If you want to change that, the chest have to be stronger, and during the movement need to expand. Then the stomach will breathe less with the stomach, meaning the diaphragm will not pull down as much, and that have a positive effect of the dynamic within the stomach area, dynamic of the organs, the movement of the organs, that have a positive effect on peristaltic, and then you get also improvement of the reflex as well.